Assalamu alaikum. Bismillahir Rahmanir Rahim. This talk, role of cessation of smoking, exercise and physical activity and social media, was to be delivered by General Farhan Tayyab, who somehow could not manage. And so I'm here. So cardiovascular disease, as you all know, is a very important cause of death worldwide. 18 million deaths occurred in 2017, and there had been rise in from 26 to 32% of all death globally. Low and middle income countries are seeing an alarming and accelerating rise in the disease burden. Only 25% of population are aware of the disease and they are seeking medical care. Symptoms of coronary heart disease arise early in our part of the world and the West. In our region, 52% of the cardiovascular deaths occur among those younger than 70. The risk factor burden was lowest in low-income countries. However, they had more rate of major cardiovascular events. Some more figures from the national data, which is 45% of adult population, they never got their blood pressure checked. 78% never got their sugar checked. 90% never had a lipid profile testing. Only 50% of hypertensive take medicines. 30-35% of the population use tobacco. And the average age for starting tobacco is 21 years. Only 10% of the diabetic have their blood glucose level in desired limits, and 60% of Pakistani adult population either fall into the category of physically inactive or a light physical activity. And 46% of our adult population is either overweight or obese. This slide shows the US heart disease deaths per 100,000, which increased from 1900 to 1950. And the reason was introduction of smoking, changes in the lifestyles, and decreased physical activity. And this was followed by fall and decrease in the US heart disease deaths till 2005. And this slide shows the same trend and the various different trials which were carried out during that period. And the reason was better understanding of the disease, preventive measures, early and accurate diagnosis, and effective management. And here you can see the proportion mortality in Pakistan, and you can see that cardiovascular disease accounts for about 29% of deaths in Pakistan. These are the risk factors which you all know very well. They are divided into reversible and irreversible factors. And the approaches to the primary and secondary prevention can be, there's a primordial approach, which is prevention of the development of the risk factor in the population group. And primary prevention is controlling the risk factors before the development of symptoms. And secondary prevention is the prevention of recurrence of the disease once the symptoms have started. So I'll be mainly focusing on smoking, exercise, and use of social media. Smoking is the single most important risk factor for the coronary artery disease. 30 to 40% of the smoking-related deaths are because of ischemic heart disease. Almost 1.4 million individuals smoke worldwide. And the patients who survive MI and who are clinically stable but continue to smoke, they have six-fold rise in the dying because in next 5 years. So tobacco is most preventable cause of the death in the world, and there are various other modes of use of tobacco other than smoking, which also include second-hand smoking, and smokers lose at least 10 years of their life. So among non-smokers inhaled smoke, as I just mentioned, the passive or the second smoking, 20 or more cigarettes daily have 2 to 3-fold increase in the total coronary heart disease. In 1 to 4 cigarettes do matter, and smoking cessation is found to reduce the cardiovascular disease mortality by 36%. So smokers who quit, they reduce the risk by 50% in 2 years, and they become equal to never smokers in 3 to 10 years. These are the various treatment options to quit smoking or cessation of smoking. And these electronic cigarettes are no more favorite. The other options are available these days, which includes nicotine replacement therapies, bupropion and varenicline. And then the control of tobacco use, that includes massive media campaigns, increasing the prices and taxes, and enforcement of the comprehensive bans on the social places. These are the risks from the smoking. On one side, you have chronic diseases, and on the other, which includes coronary heart disease as well. And on the other side is the list of different cancers. So these are the different types of banners which can be, displayed at the different places to educate the people and to, produce awareness. Now we come to exercise or physical activity. There is a global pandemic of physical inactivity worldwide. More than 1.4 billion adults have insufficient physical activity. Physical inactivity is responsible for 1.3 million global deaths annually. Here are a few examples. And urbanization and industrialization has brought a shift from physically active, physically demanding, like agriculture-based work, to largely sedentary jobs, and a switch from physically demanding transportation to mechanized transportation, widespread prevalence of physical inactivity, and sedentary behavior. So physical activity is associated with reduced rates of cardiovascular morbidity, and the recommended weekly dosage for the physical activity is 150 minutes of moderate intensity physical activity and 75 minutes of intense physical activity. So we have to implement the physical activity in the community, and we have to produce awareness in our population. And it has to be, for example, we can implement a whole of school program that includes quality physical education, availability of adequate facilities and programs to support the physical activity for all children, and provision of convenient and safe access to quality public open space and adequate infrastructure to support walking and cycling, and implementation of multiple component workplace physical activity. So these are the various physical activities like cycling, jogging, going out in the parks, and playing games and swimming. So now we come to the social media and mobile technology. It is social media is regularly used by 2.8 billion people worldwide, about 2 billion estimated mobile users in 2015. And AHA has stated that mobile technologies have the potential to provide required information to counsel and motivate individuals to engage in behaviors to prevent cardiovascular disease. 75% of the US adults use social media, and most engage at least once daily, and nearly 50% get their info about the health. Similarly, in China, more than 40 million individuals have social media accounts and which they daily engage, and more than 70% of WeChat users report to be primary source of health education. In Pakistan, there are 180 million cellular mobile connections in January 2022. So these are the most widely used social network worldwide since around January 2022, ranked by active users per month in millions. So optimal and effective use of different social media can provide a platform that can be used to communicate with people in different places and times by using videos, photographs, and text messages. And this can help in removing physical barriers that traditionally impede access to the healthcare support and resources. Mobile technologies can be integrated into the hospital and community and patient management systems. They can provide a unique research tool for the collecting much needed epidemiological data. In 2011, WHO stated the use of mobile and wireless technologies to support the achievement of health objectives has the potential to transform the face of health service delivery across the globe. So as per a recent paper published in JAMA, digital health is still in testing, but its future is bright. This is one of the trials on the smartphone and use of smartphone and social media, cardiac rehabilitation, secondary prevention for patients with coronary heart disease in China. Yet another published in Circulation. social media becomes a growing force in cardiology. And social media has made our world cardiology a lot smaller. We now very frequently interact with each other and with our patients on social media. And social media is used to disseminate information from meetings and journals to discuss and debate, and are now central to the mission of top tier journals. Organizations and various platforms can act as a virtual classrooms, and it can help improve care of our patients. But all is not okay with social media. Heavy use of social media have higher blood pressure at night, the risk factor for developing heart disease, research. So it has to be really individualized, and it has to be deliberated, and a rational use of social media is important. It has promising results, recommended as an add-on tool to current strategies, has to be used over a long period of time. Apps available only to smartphone users, not to the dumb phone users. And there is a lack of evidence of efficacy so far. So what a cardiologist can do here, a cardiologist can guide and help in developing various health apps, and can prepare messages, short videos, and then they can conduct research and interactive discussions, and patient group sharing experiences, and can be done on the social media, and the cardiologist can really play the role in these areas. So these are the various preventive strategies, which is first strategy is to target the patients who have acute illness. Second is the people who are at risk, and the third is the mass education and prevention of occurrence of coronary heart disease. So that is the primary prevention, which we are well aware of it, and then the need to shift to mass prevention. So the take-home message is it is most important to prevent this disease. It is a cause of major morbidity, mortality in our population. It is on the rise, and we need to be aggressive. And I think the main thing which the cardiology community can do is the massive campaigns. I think we know a lot about it, but we work very less. I think we need to devise ways and means how to educate our patients, how to educate our people, and we should avail each and every opportunity. Whenever a patient comes to us, we should teach the attendants, and we can, in hospital settings, we can gather the patients and their attendants and give these preventive measures lectures. Thank you very much.